New York back under a state of emergency to deal with a new variant. That's despite no detection of Omicron in the state, but the governor says it's coming. A federal judge has blocked the Biden administration's vaccine mandate for health workers in 10 states. That's after those 10 states sued the Biden administration over the mandate. And a top South African doctor says Omicron cases have been extremely mild. She calls the travel restrictions due to Omicron an overreaction. Tune in to Deep Dive as we explore these topics and more. Hello and welcome. This is Deep Dive and I'm Tiffany Meier. New restrictions popping up in response to the new Omicron variant. But as for going back under lockdown, President Biden dismissed the idea. Let's take a look at the different responses across the country. New York's new governor, Kathy Hochul, declared a state of emergency in response. While Omicron hasn't been detected in New York, Hochul said it's coming. Under the order, hospitals can turn away patients deemed non-urgent. Residents of New York City will now be required to wear masks at all times indoors. New York City's new mask advisory comes as the city requires vaccines for child care workers. New Yorkers will be required to wear a mask even if they're vaccinated. That's according to the mayor and health commissioner. And on the other side of the country, LA officials started enforcing one of the nation's strictest vaccine mandates. Now residents in the city will need to show proof of shots to enter bars, restaurants, theaters, nail salons, gyms, yoga studios, and other establishments. And now, what about federal employees who aren't vaccinated? While the deadline has passed, some federal employees will have until after the holidays to be vaccinated. That's according to a memo sent to some federal agencies by the Office of Management and Budget. The OMB said managers can wait to fire or suspend their employees until after the holidays. White House Press Secretary Jen Psaki confirmed the memo on Monday. Psaki did downplay it, stating nothing has changed regarding the deadline. She said that it is inaccurate to say that the White House has delayed anything or changed its enforcement of the rule. The deadline for federal workers to comply with the vaccine mandate was November 22nd. The American Federation of Government Employees, a union representing federal workers, praised the shift of the deadline timeline. Union President Everett Kelly said the administration has done the right thing by listening to federal workers, taking their concerns seriously, and giving those who haven't yet gotten vaccinated some peace of mind this holiday season. Now, let's take a look at what's happening in Oklahoma. The back and forth between the Pentagon and the state over whether or not the National Guard must comply is still playing out. The Department of Defense has rejected Oklahoma's request to exempt its National Guard from the military's vaccine mandate. Republican Governor Kevin Stitt said the mandate asks guardsmen to sacrifice their personal beliefs to keep their jobs. The governor said, "We estimate that over 800 Oklahoma guardsmen have not and do not plan on receiving the COVID-19 vaccine. This constitutes 10% of Oklahoma's overall force." He went on to say it is irresponsible for the federal government to place mandatory vaccine obligations on Oklahoma National Guardsmen, which could potentially limit the number of individuals that I can call upon to assist the state during an emergency. The Pentagon press secretary disagrees, saying to maintain a healthy and ready military force capable of protecting the American people, the immediate vaccination against COVID-19 is an essential military readiness requirement for all components and units of the military, including the Oklahoma National Guard. Austin says the governor's concerns do not negate the need for this important military readiness requirement. He said Oklahoma is the only state that has expressed this concern.
By not taking the vaccine, therefore not meeting a mandatory readiness requirement, an individual in the National Guard could put at jeopardy their ability to continue to serve in the National Guard.
Stitt said that about 10% of Oklahoma's force could be fired if the mandate remains in effect. And now, what about healthcare workers? A federal judge has blocked the Biden administration's vaccine mandate for health workers in 10 states. The temporary pause applies to workers at Medicare and Medicaid certified facilities. The agency says it affects 17 million healthcare workers at 76,000 facilities. 10 states had sued the administration, saying the mandate is unconstitutional. The 10 states are Missouri, Nebraska, Alaska, Arkansas, Kansas, Iowa, Wyoming, South Dakota, North Dakota, and New Hampshire. And the judge agrees with them. He wrote, Congress did not clearly authorize CMS to enact this politically and economically vast, federalism-altering and boundary-pushing mandate, which Supreme Court precedent requires. The judge says the mandate would impose a burden on healthcare facilities and make it harder for them to do their jobs and save lives, adding, truly, the impact of this mandate reaches far beyond COVID. The preliminary injunction will only apply in these 10 states. Missouri Attorney General Eric Schmidt reacted by saying, while today's ruling is a victory, there's a lot more work to be done. Let me be clear, my office will not back down in this fight. I will continue to push back every step of the way on the tyrannical overreach of government that we've seen every single time and in every level of government. The White House, meanwhile, has praised its vaccine mandates as effective. Last week, it said its mandate on federal workers achieved 96.5% compliance. Now, let's turn to a different state, a different result. The Supreme Court on Monday rejected a lawsuit by Massachusetts hospital workers challenging their hospital's vaccine mandate. 8 employees of Mass General Brigham filed a lawsuit. They were placed on leave or terminated for not getting the COVID-19 vaccine. Justice Stephen Breyer denied the request and offered no comment. The plaintiffs say the hospital system declined to grant the employees religious and medical exemptions. The plaintiffs also argued that the hospital system's mandate is a violation of the Americans with Disabilities Act and Title VII of the Civil Rights Act that prohibits religious discrimination in the workplace. In October, the Supreme Court voted 6-3 to let Maine require healthcare workers to get vaccinated without allowing religious exemptions. The court also rejected a petition from New York City teachers and a group of students who attend Indiana University. So with all of these responses, what do we know about Omicron? One South African doctor says imposing travel bans is a knee-jerk reaction, and the cases they've been seeing have been mild.
The majority of what we are presenting to primary healthcare practitioners are extremely mild cases, so mild to moderate. And so these patients means they don't need to be hospitalized for now. I have seen vaccinated people and not really very sick. That might change going forward. As we say, this is early days.
Dr. Coetzee says those mild symptoms include fatigue, scratchy throat, and body aches. More countries are confirming cases of the Omicron variant, including Japan. And some 70 nations and municipalities have imposed travel bans focused on 7 African nations. Coetzee calls the travel restrictions an overreaction.
I think it was an overreaction. I do understand that there's a lot of mutation in this virus. I do understand that it might be much more fast spreading than the Delta variant. People say, yes, but I'm trying to protect my people. So then the question would be, how do you know it's not in your country yet? How do you know that a lot of those infections that you are currently seeing that is severe, how do you know it's not maybe related to the Omicron? How do you know?
Coetzee explains that unlike the Delta variant, patients have not yet reported loss of smell or taste, and that doctors have not detected any major drop in patient oxygen levels. Local hospitals have also noticed more young patients under the age of 40. Vaccine makers are now working to test their products against the new variant. Moderna's chief medical officer estimated that results of that testing could come in a matter of weeks, but added that if a new vaccine is needed, it won't be ready until early next year.
We think within weeks, maybe 2 to 3 months, we would be able to have a Omicron-specific vaccine booster available for testing and then for administration. So, this is going to go at the fastest possible speed.
And on top of that, one Maryland-based biotech company known as Novavax is developing a redesigned version of the vaccine that specifically targets the Omicron variant. It plans to start the testing and manufacturing phase within the next few weeks. And now before we end, a new crop of pet names is making the rounds this year. Rover.com released its annual report on 2021's most popular pet names. While the usual names like Max, Bella, Oliver, and Luna remain favorites for dogs and cat owners, choosing pandemic-inspired names was also on the rise. According to Rover, the use of Fauci for man's best friend jumped 270% this year, while COVID as a pet name rose 35%. Pet owners were also inspired by working from home technology and content on streaming services. Rover saw a significant increase in animals named Zoom, Siri, and Google. And Grogu from Disney Plus's The Mandalorian was the #1 trending dog name in the country. But what do you think? Let me know below. Thanks for tuning in to Deep Dive. I'm Tiffany Meier, and see you soon.